My name's Cody Butler. I'm a resident of Brookings, and I own and operate U-City Property Management. I felt something I'd never felt before and knew that something wasn't quite right. And I've had some family in the past have that same issue. And so I was aware of what it was like. Well, first I went to my family doctor, or my wife and I's family doctor, and she checked it out and recommended that I go see Dr. Christensen. In my initial consultation with him, he talked about how many hernia repairs he's done in his career. I can't remember the number, but it was a lot. And then also how many he does a week and how frequently he comes to Brookings Hospital to do repairs like that. So the sheer numbers and experience that he had was really reassuring. Plus, he really sounded like he knew what he was doing. When I walked in the door, they were ready for me, it seemed like, and I was handed off between a few different people, and it just seemed really perfectly coordinated, like as if they might have had a meeting about me that morning. That's kind of how I felt about it. Like, these people knew I was coming, they met, they said, you take Cody in first, and then you take second. And it just seemed like a well-coordinated handoff between several people. Because there was a few different jobs, getting checked in, doing some paperwork, doing the pre-op with the nurse, and then the doctor coming in, and then being taken into surgery. It was all like super easy and calming, really. How well coordinated it was really put me at ease, because I was a little bit nervous about it. It was like a vacation, and I needed one because I was working super hard. We've got a new infant at home and a 4-year-old, and it was a really challenging time. But my wife pulled up and she said, do you want me to stay with you? And I was like, no, I just need some alone time right now. So I came in and I was able to relax, and people took care of me, and I had no phone. I laid in bed. They gave me food when I wanted it. So I would say it was kind of like a vacation, honestly. It was fairly easy. We strategically did the surgery, I think, on a Thursday, so I could take Friday off and have Saturday, Sunday to recover, and I went back to work on Monday. I wasn't like 100%, but my job, I'm not lifting. The pain wasn't all that bad, especially after day 3, and I was back to work and functioning pretty normally. The coordination was really important. Like, I don't know the details about how this all gets done, but I know when I walked in the door, I was greeted, I was handed off to another person, all the way through the end. When I was wheeled into surgery, there was 3 people in there, I think, and they weren't preoccupied getting ready. They looked at me and greeted me, said hello, assured me that they're gonna take care of me. And then, I wake up later, and there's a nurse waiting for me to wake up, and just that whole flow from when I walked in the door to when I left was really well coordinated, and it was reassuring to me. Doing it locally was way easier logistically. Plus, the Brookings Hospital with the new buildings and the renovations just seems like it's on the up and up.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.